This is an important milestone for our performing artists who've been waiting patiently in the wings since March. Of course, we won't see crowds flooding into their venues, but from the 11th of July, our theatres, operas, dance and music shows can start putting on outdoor performances to socially distant audiences. That means theatregoers can experience a live play for the first time and in months and at places like the stunning Minyak Theatre in Cornwall. And music lovers can attend Glyndebourne this summer. We are taking various measures to make these places safe as they reopen. Venue capacity will be reduced, and organisations encouraged to move to electronic ticketing to help test and trace. But our performing artists deserve an audience, and now they will be getting one. And while those outdoor performances get underway, we'll be working with public health experts to carefully pilot a number of indoor performances, from the London Symphony Orchestra at St Luke's to Butlins, to work out how we can confidently usher socially distanced audiences indoors as soon as possible. At the same time, we're funding scientific studies to help us understand and mitigate some specific public health risks, like the impact of singing, wind and brass instruments on transmission. The more we know about the coronavirus in every setting, the safer we will be. We're also taking steps through the planning system to protect theatres and venues from demolition or change of use. And of course, all of this comes on top of the unprecedented £1.57 billion package of emergency support to help arts, heritage and cultural institutions weather the COVID storm. But of course, we want to see all of our venues open as soon as it's safe to do so. And today's announcement brings us a further step closer towards that reality. Now, having allowed hairdressers to reopen, beauticians, tattooists, spas, tanning salons, and other close contact services can now do the same, I'm pleased to say, from Monday. Of course, that will be subject to some restrictions on particularly high-risk services. As I've seen for myself at the Royal Academy this morning, the National Gallery, and as we'll see shortly from the National Museums Liverpool, our cultural institutions are beginning also to welcome back visitors. And as these places begin to reopen their doors, I'm really urging people to get out there and to play their part. Buy the tickets for outdoor plays and music recitals, get to your local gallery and support your local businesses. And we've seen in recent weeks how our landlords, waiters and shop assistants have welcomed customers back with open arms whilst doing so much to keep their communities safe. It's time to give other businesses those same opportunities. And the Chancellor this week set out a bumper package of tourism and hospitality tax breaks to get these industries firing on all cylinders once more and protect the millions of people who work for them. That means a VAT cut on everything from tickets to shows, theatres, amusement parks, museums and zoos, lower costs for hotels, inns, caravans and campsites, and vouchers for food and non-alcoholic drinks. And I'm urging British people to make the most of this summer safely. We need them to support the places that we all love. And today there is good news for our nation's fitness. As we all know, exercise is incredibly important for both physical and mental health. Even at the height of the lockdown, it was considered an essential activity, with countless people hitting their parks for their daily run or transforming their living rooms into temporary gyms. And from this weekend onwards, millions of people will be able to rejoin their local sports teams as soon as their organisations publish approved guidance. Recreational cricket is back on this weekend. Five-a-side football, basketball, hockey and countless other sports will follow shortly after. And from this Saturday, they'll also be able to enjoy outdoor pools and water parks. And from Saturday the 25th, people will no longer have to work out in their park or on their living room floor. They'll be able to get back into their gyms, their indoor swimming pools, their leisure centres, and jump on that spin bike or treadmill for the first time in months. Now, we've made a number of positive visits to gyms in recent weeks, and of course we'd hoped to do this sooner, but we really do have to phase this properly. We'll be giving gyms the certainty, clarity and time they need to reopen safely so that the maximum number can open their doors in just 2 weeks' time. And again, we've worked intensively with both professional bodies and the experts to get us to this point. And facilities will have to take a number of measures to protect their communities. That includes, for example, using timed booking systems to limit the number of people using the facility at any one time, reduce class sizes, equipment will be spaced out, and there will be enhanced cleaning throughout. As always, the public will need to do their bit and follow the guidance sensibly and safely. All of these measures we are taking are conditional and they are reversible, and we will not hesitate to impose lockdowns where there are local spikes, as we saw in Leicester where things remained closed, and of course in any other place when that is necessary. But the return of gyms and recreational sport is a vital part of our battle against coronavirus. We need to get the nation match fit to defeat this disease. And our fight began with a collective effort, and I really hope it will end with one. At the beginning, we all stayed at home to protect the NHS and save lives. Now the British public has a new part to play. It's time to eat out to help out, to enjoy the arts to help out, and to work out to help out. It's over to all of you to help the country recover safely. Thank you. And with that, I will now turn to the questions. So first of all, we have 2 questions from the public, starting with Stephanie from Birmingham, who's on video. Stephanie.
What is going to be done to support the retail sector during this trying time? Redundancies are being made en masse across retail stores, and all help so far, such as the reduction in VAT, seems to be aimed at the leisure and hospitality sector. The high street is struggling and many jobs are at risk. What is the government going to do to try and turn this around?
Well, Stephanie, thank you very much for your question, and you're absolutely right to highlight the importance of supporting our retail sector. The Chancellor announced a large number of measures that will benefit the retail sector in his statement just yesterday. So, for example, we've been encouraging people to get back to work by having the £1,000 bonus for businesses that unfurlough their staff. We're also investing in traineeships and apprenticeships, and all of this is about getting the economy moving. And of course, when you think of a measure like the Chancellor announced yesterday, the Eat Out to Help Out, we very much hope that when people go to their local pub or their restaurant to eat out, those are offering in the centre of towns, hopefully that will encourage the footfall to those areas so we get more people going to our shops as well. And in addition to that, if you look at the stamp duty cut that he introduced, it's usually the case that as you move home, and we hope lots more people will move home because of this stamp duty cut, you'll have more people going to the shops to refurbish their homes, whether that is buying a new sofa or whether it's buying some new wallpaper, paint. All those sort of things will help kickstart the economy and generate more jobs, which is exactly what we're about. So thank you for that question, Stephanie. And now over to Victoria from Ivor Heath, who's written her question. She's asking, with all children being expected back into school in September 2020, what precautions are going to be taken with social distancing? As you say, children only experience mild symptoms, but as a parent in a household of 5 children, this is a very worrying time. Are tests available to the entire family if one child has symptoms? Well, look, Victoria, you're absolutely right to have concerns. Of course, we all have concerns. I have 2 young children myself, one of whom is back at school, the other will be back in September. And, we all care about our children who we love so much. We want to do the best for them. That's why I'm absolutely confident that the Education Secretary and the Health Secretary and the Prime Minister would not have permitted this to happen were it not safe to do so. That's why we've got very rigorous regimes in schools. So, for example, in relation to cleaning, in relation to keeping year groups self-contained in order to minimise those risks. On your point about testing, we have said that anyone who has symptoms, they should immediately call Test and Trace and they'll get that test straight away. So that is available to everyone. Thank you for that question, Victoria. Now we're going to questions from the media, and we're starting with Laura Koonsberg from the BBC. Laura, are you there?
I am. Hopefully you can hear me. Thank you very much, Secretary of State. You're announcing a lot of reopenings today, but will there be sanctions for business or consumers who flout the rules you've put in place to allow people to open safely again? And if I may ask you, as Culture Secretary, how do you respond to the BBC's decision to scrap the free licence fee for most over 75s, given that it was the Conservative government's decision to put this cost onto the organisation in the first place?
Well, thanks for those questions, Laura. In terms of flouting the rules, I've been tremendously heartened by how the British people have behaved during this crisis. Good British, decent common sense has prevailed throughout. And of course, there have been pictures of occasional breaches, but if you look up and down the country, countless pubs, restaurants, other venues, people are observing those rules. And they're observing those rules because they know it's the right thing to do in order to protect us from this virus. Of course, if the virus starts to spike again in local areas, we'll have to take necessary measures. And I think the British people realise the risk of that and will be confident not to do so. In respect of the BBC, look, I very much regret the decision that the BBC has taken. We gave the settlement to the BBC back in 2015. They said that it was a good settlement, and I regret that they couldn't find efficiency savings in order to avoid having to impose the licence fee on the over 75s in the way that they have set out. Any follow-ups there, Laura?
Can I just come back on your first point? You said you hope people will have common sense to obey the rules, but if either businesses or consumers don't, will there be any sanction for people who ignore the rules and potentially put other people in danger?
Well, as I said in response to the first answer, our experience so far has been that has not been necessary because the people have followed those rules. But of course, in respect of individuals, if there's clear flouting of the rules, for example, in large groups and so on, we have seen that the police have powers to disperse. And in respect of businesses, we have the Health and Safety Executive and others who will uphold relevant standards. Now over to Sam Coates from Sky News.
Thank you, Secretary of State. To go back to gyms and nail bars, people need confidence. Now, Jeremy Hunt and William Hague both today said that there needed to be proper mass testing, and this is the crucial bit, including people without symptoms to keep the virus in check. Now, is that even a government goal at the moment, and how long will that take? And one other thing, a Sky News investigation today revealed that during April, test data was being collected on handwritten bits of paper with ministers calling round looking at Excel spreadsheets themselves. Did you prioritise hitting an artificial deadline over doing things properly and safely?
Well, first of all, in respect of tests, we continue to massively ramp up the number of tests available. I think the latest figures show it's about 300,000 tests are available. We've already introduced the ability to call this a phone line in order to get a test. Throughout all of this, we've ramped up the numbers. We've ramped up the testing and tracing capacity. That's why we've introduced test and tracers. We've got over 27,000 of those. And they are identifying contact of people who have tested positive, and they are requiring them to isolate. So that's tens of thousands of people who have been in contact with people who have tested positive and who are self-isolating and stopping the spread of the disease. We think at this stage that is the appropriate way to proceed. In respect of your comments on handwritten notes scrabbling around, I really don't recognise any of that. Throughout this crisis, we have taken on challenge after challenge and we have dealt with it. So, for example, we created the Nightingale hospitals at record speed. We've set up the track and trace system. We've rolled out massive amounts of protective equipment, over 2 billion pieces, and far higher numbers on order as well. So that's the basis on which we've proceeded. But any other follow-up, Sam?
So just to be crystal clear on the answer to the first question, you're saying no, there is no plan to move to a system of mass asymptomatic testing. We're not going to proceed with that. You think the other measures are enough at the moment?
Well, of course, these are matters for the Prime Minister and the Health Secretary, but the point I've made in respect of all of them is that we have an effective regime, and we've have an effective regime for a number of reasons. First of all, we have massively ramped up the testing capacity. Off the back of that testing, we are ramping up the amount of tracing. Off the back of that tracing, we are ramping up massive numbers of people who are self-isolating, reducing the transmission risks. And a result of all of that, you see, day in, day out, on a rolling average basis, we are continuing to keep this disease under control. And in areas where there is a local spike, for example, in Leicester, we have imposed lockdowns. This is a process that is working to control the disease, and I think it's the right way to proceed. Now, thanks for those questions, Sam. Over to Dan Hewitt at ITV.
Good afternoon, Secretary of State. You have always said as a government you are led by the science. So can you tell us how the decisions you've come to today are still based on the science rather than just the very pressing needs of the economy? And a second, if I may, what data have you seen since Saturday, since the reopening of pubs and hairdressers and restaurants, etc., to inform you and suggest that it's safe to open up gyms, etc., in the coming weeks?
Well, thanks for both of those questions. Yes, of course, we continue to be informed by the science. And this afternoon, I had further extensive conversations with the Chief Medical Officer, Chris Whitty. In terms of how that has then affected the measures we've taken, and you'll see this in the guidelines that we publish in respect of gyms, but that has, for example, led us to advise to reduce class sizes. There's a particular transmission risks around the equipment, so making sure that equipment is cleaned properly. We need to ensure social distancing, and we need to take steps to improve ventilation. All of that has been guided by the science. In terms of the timings of this, clearly we have a rolling programme of reopening, and as that reopening continues, we continue to analyse the evidence and the data from it. And of course, that is one of the reasons why we are waiting a little bit longer in respect of the steps in respect of gyms, because we want this path to continue downwards, because the lower the incidence in the community at large, essentially the more risks you can take, the more you can start to open up, because the lower the numbers are in the community at large. And all of that is informed by the science. But any further?
Yeah, on the data, are you confident that the data you've seen so far suggests that this is safe to do what you're doing today? I mean, how much data could you have seen? Because speaking to a couple of scientists today, some on Sage suggested actually it might take a couple of weeks at least to see the data from last weekend to suggest you can make a new raft of changes.
Yes, of course. I mean, all the data is continuing to move in the right direction. So prior to the 4th of July, we announced a number of easements. We haven't seen as a result of those easements that the number is increasing. In fact, it continues to decline. And of course, we will continue to monitor the situation to ensure it continues to decline. But we are confident enough that as we continue on this trajectory, that by the 25th of July, we'll be in a situation where we can reopen gyms and other facilities in that way. We've always proceeded in a careful and cautious way. And of course, through all of this, if there is any evidence that of measures of incidents increasing, things going in the wrong direction, we won't hesitate to take steps. And the Health Secretary has set out a sort of escalation path for that, the sort of end point of which is local lockdowns if necessary. So thanks very much for those questions. Now I think we're on to Mesa Hall for the Express. Mesa.
Good afternoon, Secretary of State. Thank you very much. As people go back to the pools, the leisure centres and the gyms, they're going to find there are a lot more rules and regulations to worry about. For example, in swimming pools, there's no butterfly stroke, there's no overtaking. People are supposed to put on their trunks before they go to the pool. How are you going to persuade the doubters that sport and leisure isn't about to be a lot more hassle and a lot less fun than it used to be? And if I could just press you as well on the issue of TV licences for the over 75s. I mean, this is really punishing a part of the community that have faced isolation and loneliness through shielding during this crisis. As Culture Secretary, can't you force the BBC to cough up for this benefit, as the Prime Minister has repeatedly said? And if they won't, isn't it perhaps time to get rid of the BBC licence fee?
Lots of questions there to cover. Look, I think in respect of the experience of swimming pools, or indeed all of the rest of the areas we've reopened, I'd love us to be in a situation where pubs were as we know and love them, where you can crowd around the bars and, you know, people can shout and all those other things. The judgment we've taken with this and with swimming pools and elsewhere is that it's better to reopen with those restrictions and not reopen at all. Of course, it's going to take a while for people's confidence to build. It's rarely the case that you pull up the shutter and everyone comes rushing in. But equally, the experience in the UK and elsewhere is that over time, people have gained confidence and have started to engage more. But that's one of the reasons why the Chancellor announced this whole suite of measures to stimulate people to go out, whether it's the Eat Out to restart the economy, or whether it's in relation to the VAT cuts. In relation to the over 75s, the government has been clear all along that this was a good settlement. The BBC themselves described it as a good settlement, and we very much regret the fact that they have not kept over 75 licences free. In terms of further measures that we're taking, we're already consulting on decriminalising the licence fee, and of course decisions like this will have an impact on that, and we'll be announcing the outcome of that consultation over the course of the summer. In respect of the licence fee model as a whole, the charter review the charter set it out to 2027. But of course, all these factors will be considered as part of looking at the way forward. I think for the BBC, there are lots of challenges. I've already said the challenge of ensuring impartiality, the challenge of respecting all parts of the United Kingdom, and the challenge of how the BBC adapts what is essentially a linear model to all this sort of on-demand services. But any follow-up, Mesa?
Well, just on the licence fee, your party's election manifesto last year trumpeted the value of the free licence fee for people aged over 75. Aren't people going to feel let down that it's being got rid of so quickly after the election?
Well, I feel let down that the BBC haven't funded this. I'm sure people up and down the country will feel let down that they haven't funded it. Our manifesto said that we thought that they should fund it. I've made that position clear to the BBC, and I've not changed my mind on that. So thanks for those questions, Mesa. Over to Charlie Cooper at Politico.
Hello, thanks for having me. A lot of people are going to be really pleased to hear that gyms and leisure centres and other places are now reopening as well. Government advice is that face coverings should be worn in enclosed spaces where you're likely to come into contact with people that you don't know. Does that mean gyms? And are you yet wearing a face covering when you go to the shops, for instance?
Well, actually, I went on the face coverings. I actually went to the Royal Academy this morning, and I wore a face covering for that in line with the guidance that they've issued. In respect of gyms, we've announced a whole series of mitigating measures that we would expect gyms to take. I've outlined some of those. There's a lot more extensive measures set out in the notice that we'll issue. We have not taken the decision to require the wearing of face masks in respect of gyms. Any follow-ups there?
Yeah, you said you spoke to Chris Whitty, the Chief Medical Officer, today. Do you get a sense from speaking to him that at some point the UK is going to have to make it mandatory to wear a face covering in those enclosed spaces that I mentioned, like shops and potentially like gyms going forward? Do you think it's a good thing for ministers like yourself to set an example by wearing them in public, like you say you have? I mean, should the Prime Minister be seen wearing his face covering?
Well, I think the approach we've taken to face coverings, which is endorsed by our scientific advisors, is it's context specific. So, for example, when I was wearing it, the institution had decided to require people to wear them, and I abided by those rules. And I'm sure anyone visiting would abide by those rules. The similar rules apply on public transport, and I think that's the right way to do it. To have a proportionate approach, whereby wearing masks is one way of mitigating risk, but it sits alongside a whole suite of other things. The most important of which are wash your hands, socially distance as appropriate, so that's 2 meters or a meter with appropriate mitigation measures, and of course, if you're symptomatic in any way, immediately to call the relevant hotline. And I think that's the approach we're taking. So thanks for those questions. Finally, we're on to Daniel Binns from the Metro. Daniel.
Hi there. The government is still advising people to avoid using public transport unless their journey is essential. In light of other lockdown measures being eased, why hasn't the advice changed, and how does the government expect people who do not have cars to get about? If the government believes it's safe for people to go to the pub, gyms and swimming pools, isn't it also safe to get on a train?
Well, look, thanks for those questions. But this is one of the reasons why we've had such an intense drive on things like cycling, walking, other forms of exercise where people can do it. But we have said all the way through that if there isn't another alternative, then you should use public transport, wearing a mask and taking the other mitigating measures as necessary. And I think that's the right way to go about it. It is also worth bearing in mind that, of course, in London, lots of people use public transport. As you get outside of London and the big cities, the vast majority of people use cars and continue to do so. And any follow-ups?
Well, I mean, train companies insist they've introduced social distancing measures, various hygiene measures. So why are they any different from pubs or other places that are, having the lockdown relaxed?
Well, the position in respect of pubs and indeed in respect of public transport, trains, is that you should socially distance in respect to them. So they're both subject to that. In all of this, and this is an important point to get across with all of it, that throughout the reopening, we are seeking to minimise risk, do so in a safe way, and open up as much as we possibly can. So we are saying to people, it's better to go to walk or to cycle. Indeed, it's very good for your public health, and now you can go to the gym as well. But if you're not able to do those things, you're not able to use private transport cars, then you can use public transport. That's just essentially a way of minimising risks of transmission. It's what we're doing across different sectors. Of course, as the numbers continue to fall, we keep all of these things under review, and I've just announced a whole suite of further measures that we are taking, and we will take further measures if it is safe to do so. Throughout all of this, the clear objective of the government, my clear objective in respect of sectors for which I'm responsible as Secretary of State, is to get us back to them opening up as soon as possible, to get back to as close to normal life as soon as possible, but only if it is safe to do so. And that's what we have in these announcements today. So thank you for those questions. And with that, we conclude this afternoon's press conference. Thank you very much.